Hello, everybody. It's Wednesday, not Tuesday. It's 12:30 and not 12. We're switching things up here this week. Simran is joining me. I think a number of you already follow her. She's totally amazing. We're going to talk a little bit about her and her story and her work. She's a doctor. We're collaborating with a few other people on an upcoming project around nutrition and health and wellness. It's a topic that I think comes up for lots of us, and there's so much conflicting information. And so we're trying to collaborate to present information that's really medically backed, positive, empowering. Hello. Hopefully Simran will be here any second. There she is. Let's do this. Let's go live. I think it's gonna work. Hello.
Hey, Kristen.
You look great.
Oh, thanks. I was like, oh, let me take my glasses off. I've been wearing them for like 6 months. So I actually put my contacts in for you.
Awesome. I love it. I didn't do anything. I'm still fully COVID mom here this morning.
Oh, it's all good. Sometimes it feels nice to get a little dressed up.
Oh my gosh, it really does. I have been trying to like once a week put on like actual clothes, not a sweatshirt, like put some makeup on. My new COVID habit is that I wear basically every day glittery eyeshadow because you can't see it on video, but it just makes me feel fun. Like it's very
Life-changing.
I'm like, I'm doing something to make myself feel dressed up.
I mean, don't get me wrong. I'm still wearing yoga tights, right? So.
Okay. All right. That does make me feel better about my hat situation.
I love it.
So I was just doing a quick intro and saying, we've recently connected. I've been following you for a while, but we have this new initiative that we can kind of talk more about. And I'm really excited to have you on in our little cohort that's going to be doing these nutrition talks and panels and giving out info, because it feels like there's so much conflicting information. And I saw on your stories this morning that you're doing a thing about dairy, which I feel like is one of those things that you get so much misinformation about. So I can't wait to kind of hear about that.
Yeah.
Before we dive in,
yeah.
Why don't you just quickly do a little intro before we just jump in? Because not everybody knows who you are on our.
So the quick 411 is that I am I'm a I guess triple board certified physician, initially internal medicine, and then I did a fellowship in hospice and palliative care, which is what I'm actually working in right now. I'm an inpatient palliative care physician, which basically means I care for people who have very serious illnesses, a lot of times at the end of life. So it's been an intense year with COVID. And then most recently in November of this year, I got board certified in something called lifestyle medicine, which is a newer entity within medicine. And it really focuses on the different lifestyle aspects like diet and exercise and, emotional resilience and things to really help with treatment of chronic illness, but also in some cases, reversal and improvement in quality of life. So that's me professionally. Personally, I'm Canadian originally, but we live in the States. I have two little kids, 2.5 and 4, married, and I am a BRCA1 carrier. My mom's a 2-time breast cancer survivor. I found out about my mutation when I was 25, 26. And now I am about almost 5.5 months out from bilateral mastectomy with aesthetic flat closure, and a total hysterectomy on an estrogen patch. So,
yeah, it's so much. It's funny because I think people outside of the breast cancer community, we all rattle off our stats and know like the alphabet soup language of the community, but it's so much information, and we've all had so many different interventions and information and hereditary risk and dates and stats. It's crazy. So
I decided to after this year, I thought, hey, Maryland has put out this thing called Operation Courage for healthcare workers, and it's really counseling and assistance and things like that. So I was like, okay, let me try. Like, it's been a tough year. My husband's a critical care physician, so it has been a year for us professionally.
I'm sure.
We have seen some stuff. And so I was like, okay, let me sign up. Let me, see how counseling goes and everything. And after I told the lady my story yesterday, like, I really felt like she was the one that needed counseling from my story of like all the stuff I told her I'd seen at work and then my surgeries. And she was just like flabbergasted.
Yeah, I can't imagine actually, being someone who has gone through this and helped with your mother, and there's so, like being a physician and then in this moment doing end of life care, it must be completely overwhelming.
It's been a while. It's been a wild year. Like I don't think there are words to describe what my husband and I have seen this year. Like it's been it's yeah. I mean, I don't even have words. It's been a really hard year.
Yeah.
So
I think the awesome thing about what you're doing and your approach is that you have this sort of holistic wellness lifestyle part of your practice, and that it's certified must change also how you experience your profession. But it's so new. There's so many doctors who see such horrible, terrible things every day, and how that affects you as a physician and a person and a wife and a mom. I don't have the words. Like, who has the words? Therapists?
The thing is, the thing is that now more than ever before, I mean, a lot of highly functional physicians often turn to alcohol and drugs and even suicide, and it's at an all-time high right now because of COVID, and not just doctors, but like healthcare professionals in general. The beautiful thing about lifestyle medicine is that when you start learning about it, before you teach it to your patients, you practice it. And because you practice it and you do such intense work, it really helps you find that balance and that peace of mind that you're looking for, which is what people try to mask with drugs and alcohol and things like that. So it's been a true blessing. And then, of course, I had my own issues with like bouncing back emotionally after my surgeries and being in menopause at the age of 32, and what's sex going to be like, and like just all these questions in my head. I had no idea. So the way I was eating, the way I was moving my body, the things I was doing for emotional and stress resilience has paid off so well in terms of my recovery. So it's helped both. It's helped the professional stress that COVID brought, but it also helps the personal stress of bouncing back after surgery. So for me, I totally believe in it. And again, everything I do is evidence-based. That's why I went and took a board exam for it. I know on the internet, it can be so overwhelming because there's so much misinformation these days with social media. So that's why I'm all about kind of the evidence, and sharing it. Yeah.
Yeah, it's awesome. I love, you're so unapologetic and in the best way about, you're like, this is the information and this is what it says and this is what I'm doing. And you can decide that you don't want to hear it, but you can't really argue with it. And I think, it's so great that you're someone who's not just preaching it, that you're also practicing it. And I would imagine that because your husband's also a physician, that you have support, right? Like you're not trying to convince someone who has a completely different understanding or lifestyle or, or experience, even like you're both physicians during COVID, right? Like it's almost like you're war buddies,
And
you're
you know
in it
what,
together.
though? It actually took COVID to get him to practice self-care. Because for the last 11 years of doing critical care, it's just, and he works 12 days in a row and has 2 days off. So his schedule is crazy. And we have 2 toddlers, no family here. And so, he's just kind of been like, just go, 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 go. And then this year it was like, if he kept going at the pace he was going to completely burn out. So he's actually just catching on to okay, I really need to slow down and take care of my body because 42 is not easy with toddlers.
Oh yeah.
So
totally. So what is, Allison is asking this, how do we, and hi Allison, I see lots of friendly faces on here today. How do we support our local physicians? I also want to know, what does self-care look like for you guys, given the pace of your life and having toddlers and all of the knowledge that you have? Like, how do
Well,
you
it's
implement that?
interesting. I think self-care is very a very personal thing. Lifestyle is a very personal thing. Food is a very personal thing. And I think in medical school, um, we were taught like, okay, management of high cholesterol and high blood pressure and diabetes, lifestyle interventions first. And that's what I remember telling my patients, but we weren't actually taught what that means. You know
Right.
what I mean? So like I think I got like in my all of medical school, I think got like 15 or 20 hours of nutritional training, and that was mostly biochemistry. So most of what I talk about on my social media and just in general when I talk, most physicians are not aware of the things I say. And so I will probably get backlash from most doctors because they'll be like, well, we never learned that yet, but that doesn't mean that it doesn't exist. And the evidence is there. And now with this epidemic of chronic illness in this country, lifestyle is coming to the forefront, and COVID brought it to the forefront even more because we
Yeah.
know, and I can tell you that the people I saw in the hospital at the end of life in the ICU were people that, had diabetes and high blood pressure and cholesterol and all of these other chronic illnesses that are lifestyle related. And most physicians actually are patients too. They have a lot of these chronic illnesses. So I think self-care is not something that doctors are good at. We are the worst patients. And I think right now, what our healthcare systems are trying to do is support us in the best way possible. Like I said, Maryland came out with Operation Courage. I think a lot of it is going to be mental health work first because we've seen a lot of trauma. So I
Hmm.
think, changing the way we eat and move and that stuff's going to come after we've gotten, for the most part, the mental health help, which I think they're doing at a bigger level because it's not just going to be doctors. It's going to be like across the spectrum, healthcare workers.
Yeah. I think for most of us who aren't in healthcare, we slowed down, right? Like, we're at home, we're finding, it's difficult, right? Like, if you're home with kids and working and all the things, like, it's a whole new host of challenges. But for the most part, we have had time to sort of self-reflect. We have to cook more because you can't go out. You can't get, at first it was even impossible to get like takeout. And so we had an opportunity, a lot of us, to sort of make some positive changes or negative changes, right? There were some people who were like, yeah, I'm just going to bake bread and eat more
Yeah, it's
buttery
like
bread.
I feel like people went one way or the other. Like some people really started focusing on some self-care and others really, went the opposite way.
Yeah.
Um,
And it's probably been really very different for physicians and healthcare workers and nurses, like anybody who's on the front lines of that. You just had to work more and harder and didn't have any time to take care of yourself. So, like,
the burnout is real, and it's to the point where I feel like, and I again, me and my husband, palliative care, critical care, like the trauma is undescribable of what we're seeing families go through. Most of what I'm doing right now is telemedicine, so I'm talking to most families on Zoom about end of life care of people that are in the ICU. They can't even be with each other. Like it's like every day I have the same meeting and I still don't have the words to say to these people. And so I was talking yesterday with one of my colleagues about like even the level of mental health help that is going to be needed
mhm,
for some of us. Most counselors aren't going to be able to provide it because they're not going to be able to fathom what we're telling them or what we've seen this
right.
year. So I don't know what it's going to look like. I think hopefully it looks like our healthcare systems really prioritizing mental health and getting away from the stigma of like, healthcare workers having to always have everything together, and recognize that we're humans and recognize that, we need the emotional health, the mental health, but then again, the lifestyle piece comes after that about how do we help with wellness. My system actually, they're doing a cool challenge in March. It's a plant-based challenge for the month of March. They've partnered with some doctors in the area, and it's free, and they have like meal recipes and like all sorts of stuff that they're doing. So I think part of it is making it fun, accountable, doing stuff with your colleagues. Hopefully more of that will be helpful.
Yeah, awesome. I think that's so great. I talk to lots of people who are consumers of healthcare, like, more often than I talk to doctors. And it's really easy for us to complain about our doctors, even if it's just like, I don't like how they talked to me about that, or the way they asked the question, or they didn't have an answer. And I think it's applicable here in that, like, you're also people, and you are trained to be, maybe just a breast surgeon or an oncologist or a plastic surgeon or a nutritionist. It's impossible for any one of us to have all of the information. But I think what feels so important is that, the doctors that we see and ask questions like, okay, what do lifestyle changes mean? That it's okay to say, I don't know, but you can go see this person, or at least feel like it's okay to not know all the answers or always be well. And I think that's sort of the point that you were making, is like, our expectation is that doctors are gods and that you're always operating at 100%. You know all the answers. You're going to be able to save everybody. And the toll that must take it's hard to imagine.
I'm going to give you the flip side to that, because I'm also a patient, and being a palliative care physician, I'm an empath. And so I give my all to my patients and my families. I listen with all my heart, and I'm compassionate, and I know I give all that. So when I became a patient, the experience I had with some of my surgeons was a slap in the face. So, walking out of doctor's offices crying is not okay for any person, because we're all human beings, regardless of how hard our jobs may be. No doctor or anybody has the right to make anyone feel less, or that their choices aren't valid or are not right for them. So as a patient, I would say, you know your body best. You advocate for yourself. If your doctor's not giving you what you need or treating you the way you're supposed to be treated, then you need to find another doctor. I did. So I think there's both ends of the spectrum. As a doctor, it's a hard job. COVID has taken a toll. I think the systems are going to have to do a lot to prioritize mental health and emotional health for doctors. But as a patient, I agree with you. Doctors are not God. You still know your body better than any doctor. And so if you need a second or third opinion, you need to get it.
Yeah, that's so important, right? I think a lot of people also are afraid to get a second opinion, or it feels like too much work, or it's hard to figure out. But yeah, like if you leave crying, of course, the physicians that you have, especially if you're someone like us who has ongoing health concerns, they're long hauling it with you. It's a relationship that you want to build and cultivate and feel good about. It's stressful enough to go to the doctor all the time. Like, it might as well be somebody who you feel like actually cares.
Oh yeah. And I added the layer of like not wanting reconstruction, and like very clear in my mind. And so the breast surgeon I first saw was like, no, you have to see plastic surgery as part of the workup. Fine. And the first plastic surgeon was like, you're 31 years old, you're beautiful, you're this, like, why, of course you need to have reconstruction. And I'm like, so my beauty is linked to me having breasts, or I'm being young, so I need breasts, or which is it? And then I went to another breast surgeon, and then he was like, I really want you to see the plastic surgeon. And I was like, no, I really don't want to. And he was like, please, just this one will be different. So it was a woman, and I was like, she'll get me, she's a woman. And she went even further to say, you will be psychologically scarred if you don't get reconstruction. So I would love to be doing this live with her right now, because I'll be like, I'm literally on top of the world. I'm not scarred.
Yeah. It's so funny. That conversation is so shitty.
Yeah,
I'm going to swear
it really is.
my own IG live. I had, when I was flat, like after my mastectomy, and I had expanders, and I was like, phew, I felt more comfortable than I felt with my first reconstruction. I was like, these feel so weird, and they move weird, and one drift. I was like, why did I do this? And no one had ever said to me, you don't have to. And right. I also was 30, and I had mine in 2013. I didn't even know anyone else who was doing it. There was no Instagram the way Instagram is now. Like, I just didn't know. Right. And I think I had to have a revision in 2017 and saw a male surgeon, and he was like, you have teenager boobs. Don't you want big, full breasts? And I was like, what are you talking? Like, you don't even know who I am. Right.
It's crazy, the assumptions people make. Like, we live in such a superficial world, right? Like, it's wild. And if you just listen to my story and just hear me out, that I've always been a double A, that I've had the beautiful experience of breastfeeding both of my babies, that, having a set of new boobs is not going to be the same to my own, and that's why I don't want it. Like, my reason was so legit, and so like it made sense, but like sometimes they just go way past like your reasoning for anything, and like it's so robotic, like, yeah, you're BRCA, yep, you're perfect for direct to implant. All right, next patient. Like
Yeah,
it's hard.
totally. And I think, we're all so different too. Like we're coming in with our own experience and what it's like living in our bodies, and they're coming in with their experience of treating lots of other people. And I'd like to believe everyone has the best intentions, and that people who say things like you're going to be scarred because of your decision are trying to help, even though it just is like, you don't get to say that.
No, and even especially as a doctor, you don't get to say that. And again, when you're a doctor patient, you come in reading all the research, right?
Right.
So I went through all the journals. I went through, past studies where they followed women about reconstruction options, and were they really emotionally scarred? Were they really psychologically scarred? And what actually most women said was exactly what you said. Most of them just didn't have informed consent. Most of them didn't know all their options.
Right.
And they just thought they only had one option. And so you're really not making an informed decision then. So anyways, it's such an interesting experience to be on both sides of the spectrum, especially this year
Yeah.
as a palliative care physician at the time of COVID, but then having like these major surgeries and all these doctor's appointments. And I mean, it's been a wild year. And because I've seen everything I've seen with COVID, and, the types of people that died because of their comorbidities, but then also how the lifestyle piece helped me with my recovery, I'm so passionate about educating and empowering people about lifestyle, and just the tiniest little things that you can do in your everyday life that actually end up making the biggest impact if you do them consistently. Like a lot of people think like lifestyle is like, January 1st, radical change, and that's just not sustainable, right? And I
Yeah.
truly believe that, like, because we live in a country with an epidemic of chronic illness, like people don't actually know for the most part what it feels like to feel good, because most people just chronically are tired and have low energy and don't feel great because of our everyday choices. And so I truly believe that once people make changes, even the smallest changes, they start feeling better, then they will consistently do those things because they feel better,
Yeah. I mean, I'm so excited to be giving some of those tips out with you and Allison and Lauren. Um, you know, for the people who are watching or who see this later, we're collaborating. And the first thing we did was make the spreadsheet where we're all offering like tips about how to do some of these things that are recommended. And it really is so simple. Like there's things that don't even feel like a change. And I tried to really think hard about like, what does exercise look like to me now that it's winter and I'm not going to yoga? And am I going up and down the stairs multiple times on purpose when I go to switch the laundry? Like, does having really good athletic sex count? Like, what are
Right.
the ways that you can do these things that are like fun and enjoyable and bring in another person? Like my kids and I were doing 10-minute workouts together 3 times a day.
Yeah, that's
I never
awesome.
got to do that with them before. Like, what are the changes that you can make that help your whole family and you, that are like quick and easy and not like scrap your whole life
Yeah.
and start over?
Especially as moms, I feel like as moms, we're always kind of saying why we can't do something, because being a mom is really hard. But then turning that from why, the reason behind why we can't do something, to figuring out how we can do it to include our kids,
Yeah,
you know?
totally.
And it's a shift of your perspective. And it totally changes things. This is like, you probably see this on my Instagram, but like that little bike right there
Yeah.
is the reason I can get on the Peloton every day.
Yeah, totally. And it's awesome. Like that, my daughter actually started riding the Peloton. She's only 9, but she likes to do the scenic rides and she's tall enough that we can
Yeah.
lower it for her. And it's snowing outside. She's like, I'm in California. And it's like she just saw me doing it and wanted to do it. And I was like,
Yep.
yeah, of course. Let's get you shoes. Let's do that too. So I think it is, and one of the ways that we've on our planning calls for the future events and content that we're putting out, talking about all the things you can add in. COVID feels so restrictive. There's so many rules. There's so many things we had to take away and give up, that if we can frame it as like, what are the things that you can add that feel good? It is a perspective and a mindset. And I think that's COVID related. It's personal, but it is also definitely a mom and a family thing. Like bring everybody in and don't be like, you can't eat this. It's like, hey, we're going to try this new thing and we're going to add this into this thing that we love, or we're going to do all of this together or take walks or whatever it is. And I think, you know, the whole premise of Brilliantly and what I feel so passionate about is giving people like helpful, practical tools to implement that make a difference. And so I'm so excited to know you and to be collaborating.
And I think of 4 years of being a mom, I'm no veteran. But what I have learned works really well is if I do exactly as I'm asking her to do, she will do it. But if I tell her to do something and I'm like, if I'm eating a cookie and I'm giving her a piece of broccoli, she's going to want the cookie. But if I'm super excited about the broccoli and I'm like, this is the best darn broccoli I've ever had in my life, you know, she's going to want to eat that whole bowl. And she does, right? So it's all like with kids, it's all about like, as at least young kids, you are like their greatest role model. And so like my husband and I really try to, like whatever we want our kids to do, we really try to model that. Me more than him, but it works. It really does. At least until they think we're still cool. I mean, once they're older, they're not gonna think we're cool, then that'll be different. But
I mean, it doesn't work as well with my 12-year-old son, but when he was the first year we had a garden, he was 4 and his favorite color was purple. And I was like, all right, we're doing purple kale, purple carrots, like anything that I could find that was purple, we grew. And he ate anything that we grew. Like he was so excited to be part of that process. And I think to your point, it's like, if you show them and you make it fun for them and you're eating it too, they're going to want to do it.
Yeah. Or put a spin to it. Like my kids are not fans of greens, but smoothies, they live off of smoothies in the morning. And today we actually put spinach in our cookies and they tasted really good. Nice. And they're like, these are monster cookies. I'm like, yes, they are, but whatever, you're eating spinach and your oatmeal banana cookie, it's cool. Like,
yeah, that's great. There's so many ways to add vegetables into like literally anything. So we'll be, you know, for people watching, we're going to be sharing recipes and tips and all kinds of stuff coming up. So stay tuned. Simran, I'm going to link to your profile, but if people wanted to like know more about you, is Instagram the best way to kind of stay in touch and follow along?
Yeah, so I'm at drsimran.malhotra. So yeah, you can follow me on Instagram. I'm trying to minimize my social media, so I'm not on tons of platforms, but just Instagram for now. And I'm doing this talk tonight on Doctors Talk Dairy. So we'll be talking about like the, you know, risks and alternatives and like all sorts of myths that are associated with dairy. The biggest being that it's just culturally what we've done for so many years. So people think that's the only option, but now there's like so many great alternatives, and so we'll be talking about that. So if anyone wants to join, the link's in my bio.
Awesome. We'll share the link in stories too, and I'm looking forward to going tonight.
It'll be fun.
Excited to learn about it. Awesome. Well, thanks so much for the time. Have a great day.
And, yeah, you too.
Keep taking good care of yourself.
Yeah, thanks, Kristen. You too. See ya.
Bye-bye.
Bye.